It is my pleasure to welcome you to Aspen Ideas Health 2019. This is the 6th year we've staged this event, and every year we look to really learn something from the year before. And I'm decided to say that at this year, all of us at the Aspen Institute have gained really tremendous focus and energy from the leadership of our new CEO and president, Dan Porterfield. Dan has reconnected us with the purpose of our work at the Aspen Institute, consistent with the inspiring vision and values of our founders. Simply put, we are driven by a vision for a free, just, and equitable society. In order to propel that vision, Dan has reminded us that it's not just the work we choose to do, but it's how we choose to do it. We can't aspire to being a good society without gaining greater access to our own humanity. In our first year with us, Dan has been an inspiring example of just how to do that. He listens deeply, he speaks thoughtfully. He's quick-witted and laughs in all the right places. He's inclusive, wholehearted, and generous. And every day he reminds us to ground ourselves in the values we all share and that we stand upon. In fact, he's Aspen's very own Atticus Finch. Ladies and gentlemen, I give you Dan Porterfield.
Thank you, Peggy. Good afternoon. Welcome to Aspen Ideas Health. Thank you, Peggy, for that lovely, slightly exaggerated introduction, for your leadership of Ruth Katz, Katie Drasser, Natalie Johnson, and your teams. Together, you've organized another exemplary series of talks and workshops, each of which helps us frame problems in ways that lead to needed solutions. Thank you as well to Margaret Lowe, all of our friends with Atlantic Live, for your generous sponsorship and partnership in doing some of the most important work. Thank you so much, Margaret. It is just awesome to be here in this tent with all of you. Just like Peggy said, the vision of the Aspen Institute is a free, just, and equitable society, and we can track that back 70 years ago to the Big Bang right here in Aspen, Colorado, when the founders of this institution put people together to think about how to create the world that they wanted. And that's what their legacy for us, our challenge, is to do that. Health is essential to that vision. For how can we be truly free if we are burdened by the fear of our loved ones suffering from diseases that are preventable or curable? How can our world be truly just if access to high-quality health care or the most promising new therapies is determined by place, race, class, or gender or sexual identity? And how can we build a society that is truly equitable when cultural and legal norms limit women's lives, including their ability to make their own health care choices? All of us here want that kind of society when we reflect upon the futures of our precious children and loved ones. This convening is about considering everyone as our children and our loved ones. Everyone in the country, everyone on the planet. A culture of health is a culture of freedom. The Aspen Institute believes that convenings like this one are essential to moving towards that vision of a free, just, and equitable society. Why do I say that? Because there's extraordinary power in building and gathering networks of values-driven leaders determined to make demonstrable differences in every way we can. By writing legislation that expands access to needed care, by finding and training the next generation of culturally competent healthcare providers at the local level, by working through the ethics of even the most revolutionary new technologies for altering life to make sure those technologies are used for good and not for ill, by applying the lens of health to all of our business practices, by addressing the social determinants of health, like nutrition, housing, education, income, and for that matter, racism and patriarchy. Let's be clear, it's values-driven leaders who make those differences. I'm thinking of people here today, so many, like the Ugandan human rights leader, Prima Kogala, who founded an initiative to help women and girls get access to free legal services. I'm thinking of Lisa Fitzpatrick, founder and CEO of Grapevine, which helps Medicaid-managed organizations help their patients improve their health literacy and thus improve the quality of their lives and their independence. I'm thinking of... This is a little bit like an auction or something because nobody knows who I'm going to call next. I'm thinking about the siblings, Hannah and Charlie Lucas, teenage entrepreneurs and mental health advocates who co-created the app Not Okay that helps teens deal with depression. I'm thinking about Senator Bill Cassidy of Louisiana, who before entering public office spent 3 decades caring for the un- and underinsured, including co-founding a clinic in his home state that provides free dental and health care. And I'm thinking of someone I can't wait to meet. Leanne Wen, the former city health commissioner and current president of Planned Parenthood, a brilliant, relentless leader in making sure women have access to the healthcare resources they need. Thank you all of our speakers, all of our attendees for being here. It's critical that we gather up leaders to identify emerging needs, include new voices, showcase promising practices, and break down the barriers to progress. That is what the Aspen Institute is all about. That's what the Aspen Ideas Health is all about. Activating change, making an impact, serving humanity, and getting results. Thank you all for being a part of this bold vision to create the world that we seek. And now I'm thrilled to welcome to the stage my friend Margaret Lowe, president of Atlantic Live. Thank you, Margaret.
Thank you so much for that inspiring open, Dan. It's a privilege to be here with you and your team 1 year into your Aspen adventure. My Atlantic colleagues and I love our editorial collaboration with the Institute on Aspen Ideas Health. This is actually a remarkable gathering. You have come from across the country and around the world, a group of people who have dedicated themselves to making people lives better, healthier, or others who made the trek because you care deeply about the issues at hand. And I'm inspired and I'm humbled to be here with all of you. And I come today with a confession. A year ago on this stage, I poked gentle fun at the fact that just down the road, another health-related conference was underway. It's happening again this year. A cosmetic boot camp, plastic surgeons and dermatologists convening to talk about the latest in nips and tucks, reconstructive surgery, while we're here grappling with some of the weightiest issues in health today. Flash forward to April of this year. I'm visiting a friend who's been diagnosed with breast cancer. She's about to do round 2 of chemo. We cook, we talk into the night about disease, about how random it can be, about what it would feel like to go bald, about the loss of control. The next morning, I wake up early to catch a train to DC. I walk down my friend's narrow steps, suitcase in hand, neglecting to turn the light on. I get to the bottom of the stairs, or so I thought. I was actually on the landing, and when I took another step, I pitched forward down 3 more steps and face planted into a table. My dear friend with cancer, who I was there to take care of, lifts me from her living room floor, and like an angel, she drives me to the emergency room. I had shattered my nose. Or as our editor-in-chief, Jeffrey Goldberg, remarked, "Geez, Margaret, you stopped your fall with your nose." How's the table? But I digress. Enter the most extraordinary physician I have ever known, a plastic surgeon, who pieces me back together and who twice a year in her spare time makes medical missions to see children in Ecuador and Guatemala to fix their cleft lips and cleft palates. I tell this story first because I feel a tad repentant for my remarks last year, and I have new reverence for plastic surgeons. But really to underscore how fleeting and fragile life is, and that our health, our physical and emotional well-being is at the core of who we are, rich or poor, black, brown or white, old or young, and no matter where we live. And that's the focus of these next few days, where we'll explore everything from universal care to the future of nursing to the power of a Broadway musical to destigmatize mental illness, all in this extraordinary setting where the clean mountain air allows us to open our minds, learn something new, challenge our assumptions, and to meet brilliant people doing extraordinary work. On behalf of the Atlantic, thank you for coming along for this ride. I know you will have a magnificent few days. And with that, it gives me enormous pleasure to bring back to the stage the one and only Peggy Clark. Peggy.
Great. Thank you so much, Margaret. And hello again, Aspen Ideas Health Community. May I get a sense of how many of you are here for the very first time? Raise your hands. Whoa, that's awesome. That's great. And how many of you have come to Aspen Ideas Health before? Raise your hand and put the numbers of fingers up of how many times you've been here. Awesome. That's great. Wonderful. We're so glad to welcome you back and to welcome the new ones. May I ask our incredible scholars to please stand so that we can say hello to all of you. And may I also recognize our extraordinary fellows, our Aspen New Voices fellows. Please stand. Woo. Our Health Innovators fellows, please stand. Our Healthy Communities fellows, please stand. And any other fellows who I haven't recognized, please stand and give a round of applause for these amazing people. And you know, it really would not be possible for so many of these folks to join us here without thanking our incredible and generous sponsors who have partnered with us to create Aspen Ideas Health. I'd like for you to take a look at who's joined us here. We delight in partnering with you to create content and to bring the scholars that you love to be with us, and we are very, very grateful. Now, as you will recognize, thank you. As you will recognize over the next several days, this is a very special community. There are 1,200 of us coming from 30 states and 22 countries. We are noble scientists, we are politicians, grassroots activists, journalists, economists, CEOs, and feminists. And we share two things, curiosity and compassion. We are unconventional problem solvers, driven less by how we can personally benefit and more by what we can change to benefit all of us. And as Dan said, we believe that good health is central to creating a good society. It's inextricably tied to social justice and to our fundamental values as a society. Access to health care, or lack of access to health care, as we all know, can really determine the trajectory of your life. Poverty and ill health are inextricably intertwined. We know this to be true deep in our hearts, deep in our bones, when a person from a zip code a few miles away from us, another person can live on average 20 years longer than another. And a doctor in the US may see only 150 patients, but in an African country, a doctor may make him or herself available to more than 150,000 people. Geography, economic standing, access to good housing, food, water, education, they all influence health. So over the next few days, you will meet people from your own field of work, be it nutrition, mental health, the environment, health policy reform, and also people you would not ordinarily meet. A pianist who believes music can inspire wellness, an Olympic gymnast and a film producer tackling sexual abuse, a scientist reimagining the use of psychedelics to treat depression, a corporate CEO providing education and nutritional coaches to her employees, an ethicist grappling with the unknown territory of genetic manipulation of embryos. You will likely walk into conversations that you've been wanting to have your whole life. And as we walk this bucolic campus, nature invites us to put aside our biases, our routines, and our quick judgments in exchange for the wonder of what's new and unexpected. If you're willing to see potential in any conversation or situation, then there will be. So let's use Aspen Ideas Health to fuel the energy that we will need for the action we must take when we leave. The idea of a healthy and just and sustainable future is not waiting on the horizon. It's not a place we'll get to if we don't act on the knowledge that we gain from this event or if we wait for someone else to do the work. It's our responsibility. So don't leave this event without exploring possibilities with the person next to you. What do they want to do? What do you want to do? How can you help each other? You might be very surprised by what you learn about them, about yourself, and about the power each of us together has to marshal the abundant, imaginative humanity together. Thank you very much. Now, it is my very great pleasure to officially open Aspen Ideas Health with our amazing 10 big ideas. Each year, we ask 10 of our participants to share one big and bold idea with us. Let's hear from them now. Ladies and gentlemen, 10 big ideas.
Hi, my name's Dan Davis. I'm from the University of Manchester in the UK. I study the immune system. I'm Jewish, and needless to say, my family's story is deeply affected by the Holocaust. So many great tragedies in history, from the slave trade to the Holocaust, has come from a misunderstanding of the differences between people. And I've been thinking about that deeply. What really are the differences between each one of us in this room? Well, we each have about 23,000 genes, the human genome. And by and large, we have exactly the same set of genes, but of course, a small number of these genes differ. Well, what are the genes that are different between each person in this room? Well, you might think that they would be things to do with our hair color, our eye color, and our skin color, but they're not. The genes that vary the most between each person in this room are in our immune system. And this is fundamentally important that we have these differences. If you were infected with a particular virus and I was infected with the same virus, you might get better in 3 days, I might get better in 4 days. And one of the reasons would be because of the different versions of your immune system genes that allowed you to do better with that particular virus. But crucially, there's no perfection in that system, because a different virus, I might do better and get better in 3 days. You might take a bit longer and get better in 4 days. There's no perfection in the genetic tapestry that connects us all together. From our deep understanding of how the immune system works, we get new treatments for cancer and autoimmune disease, and I'll be talking about that tomorrow at 9 o'clock in another tent somewhere. But my big idea for you now is that from this in-depth understanding of the immune system, we see something else deeply profound about who and what we are. And I believe that it is a profoundly deep, fundamental importance of why we are all different, because it's how our species collectively has evolved to survive disease. This is not just poetry or just something gratuitous to make us feel good. This is a fundamental celebration of why we're different. Thank you.
My name is Toni Villarruel, and I'm Dean of the School of Nursing at the University of Pennsylvania. My big idea, unleash nursing innovations. What is that? Nurses are inherent problem solvers. We use compassion, ingenuity, and science with a focus on life and living. There are many examples of nurse innovations, person and family-centric process and products that address the complexity of health issues and the intersection of social issues as well. We have an imperative to unleash nursing innovations. Let me give you an example. Francisco and Amalia, 85, 86, live alone with no intentions of leaving, despite challenges in meeting their most basic needs. Amalia has a number of complex health issues, and she sees a myriad of specialists, none of whom speak with each other. Amalia was dying, but the family couldn't agree on hospice care, and when they finally did, two months later, she passed away within 36 hours. This isn't a hypothetical family, this is my family. And what we needed and didn't get was transitional care, an advanced practice nurse at the center of the care team with my family, who would get specialists on the same page, who would get my family on the same page, and at the same time help us ensure a peaceful death for my mother. I know about transitional care because it was developed at Penn Nursing, but there are many barriers that hinder the uptake and the use of this efficacious and cost-effective model. It's just like there are in innovations for nurses, in upscaling innovations by nurses. We need to unleash nursing innovations like this by, number one, making sure nurses are in the room where it happens, by elevating nurses to the broader systemic leadership level. It's key to improving efficiency, quality and safety, and improved health. Two, we need to remove barriers at the institutional, regulatory, and policy levels that prevent nurses from practicing to the full scope of their license and implementing effective innovations. Nurses create solutions to improve health and well-being. It's time to unleash innovations to the benefit of us all. Thank you.
I take a good-looking guy to hold me. And I'm Dr. Ruth Westheimer. And since you have appointed me the Queen of Sexual Literacy, I brought my Secretary of State, the Attorney Jeff Tabak, to read you my proposal.
What I'm about to say will sound a whole lot better if you imagine me saying it with Dr. Ruth's accent. I recently took part in a debate at the Oxford Union, the subject of which was, does porn have a place in sex education? Our side lost in the final vote, and I believe part of the reason was the inherent negative aspects of the word pornography. So since today, garbage men are sanitation engineers, secretaries go by the title of administrative assistants, and prostitutes are called sex workers, my big idea is that we no longer use the word pornography, but instead we break a bottle of champagne over the bow of the good ship, sexually explicit material. Why am I proposing this idea? Because I believe there is a place in our society for sexually explicit material. It can be a part of sex education. Some people need help getting aroused, and sexually explicit material can be of great assistance to them. It can help them demonstrate to those in a relationship how to keep their sex life from becoming boring. And it can help relieve sexual frustration among those without a partner. Research has shown that the age when teens first are having sex is getting older, and one reason is probably that they are masturbating rather than having risky sex with others. That's not to say we should allow young children access. Bedroom doors should be all equipped with locks, but so should liquor cabinets. I am not saying that sexually explicit material can't be abused both in its creation and how it is used. but that's true of almost anything. Eat too much and you become obese. Drink too much alcohol and you can turn into an alcoholic. Take too many deep breaths and you can hyperventilate. But just because there's a negative side to sexually explicit material doesn't negate its positive aspects. And I believe that by changing how we describe what used to be called pornography, we can help those for whom sexually explicit material would be beneficial, but who avoid it because of the negative connotations of what it is called today.
Hi, I am Dr. Michelle Dubon, a Guatemalan obstetrician, and I'm here to talk a little bit about immigration. Yeah, a doctor talking about immigration, because immigration affects us all, and it involves everything. You have no idea how many women have come to my clinic crying and saying to me, "Doctor, please, I'm desperate. I don't have money to feed my children. I'm looking at boys in my neighborhood becoming into gangs or being assassinated by gangs. I cannot live here anymore. I need to go to the United States illegally. So please give me a contraception because I'm absolutely sure that I'm going to be raped several times on my way." That is heartbreaking. And it happened a lot of times in every clinic in Guatemala. So immigrations affect everyone. But I believe that people deserve a better future. I believe that we, decision makers, we can do a difference. Because these are, most of them, people from Mexico, Guatemala, Honduras, Nicaragua, El Salvador, and the rest of Latin America. We are good people. We are hardworking people. Yeah, we want, thank you. All they need is an opportunity. They need to earn more than $2 a day. They need to have security for their kids. So we can do something. I dream in my mind, maybe I'm crazy, maybe I am dreaming awake, but I believe that we can do something. I picture safe villages in our countries so people don't need to travel to this country. To people to have access to quality education, to people to have access to quality work and see their children raised. So we should stop building walls and we should embrace these families.
My name is Vinny Jaskula-Ranga, and I am the founder and CEO of Hunterian Medicine. My big idea is this: we need to establish a global framework for the oversight and regulation of gene editing technologies. This immediate moral imperative is to ensure therapeutic access for patients today and an ethical treatment of humanity for the generations to come. Let me take a step back and posit to you that we have now entered into a new era of civilization. Much like the eras of the past, the Stone Age or the Iron Age, we are now living in the genetic age. Future generations will look back upon this moment as an inflection point in human history. Here are 3 vital reasons for a global regulatory framework. 1, there are 6,000 to 7,000 genetic disorders, and we need to promote safe and rapid therapeutic development now. For the first time in history, there are one-time cures for these diseases, and I am happy to say, there will be many more to come. For those whose twist of fate was sealed by an unfortunate genetic typo, the genetic age gives us the magnificent power to end suffering from disease. 2, unlike the ages of the past that sought to control the environment around us, in the genetic age, something profound occurred. Innovation turned the technological gaze inwards, peering into and giving us control over that which is inside of us. For the first time in history, we have the ability to direct our own evolution, and we can do so over a single generation. It is incomprehensibly profound. 3, Like the ages of the past, technology can be used for democratizing or stratifying means. We are simply unprepared for the consequences if it can be weaponized, used to eliminate a species, or worse, used to subjugate members within our own species. We must remember, the power to cure is not all that different than the power to punish. As we harness the power of the genetic age, effective global oversight must be nimble in the face of time and unprecedented scientific achievements. Consensus will not come easily, nor will compliance. Nevertheless, it is our duty to confront the most existential dilemmas the history of our species has ever faced. Forever is truly composed of nows. So ready or not, we're all living in the genetic age. It is a wonderful paradox that as we turned our focus inwards to the cellular milieu, in reality, our eyes turned out to eternity.
Hi guys, I'm Charlie Lucas.
And I'm Hannah Lucas.
And we're the creators of the award-winning Not Okay app, a digital panic button that when pressed, it sends a text message to your pre-selected up to 5 closest contacts with a text message that says, "Hey, I'm not okay. Come call me, text me, or come check up on me," along with your current GPS location and directions.
And our big idea is to have a world with 0 deaths by suicides in the next 10 years.
As of 2017, suicide is the 10th leading cause of death in all ages in the United States, and the second leading cause of death in ages 15 through 19.
Around 123 people, including 22 veterans, die by suicide per day.
And not to mention on the global scale, 800,000 people die needlessly by suicide each year. That's about 1 person every 40 seconds.
So that means approximately 2 people have died by suicide since we've shared our big idea.
And 2 people more will die before we're finished.
And I know having a world with 0 suicides sounds practically impossible, but it can be done within as little as 10 years by having
all educators and physicians being mental health first aid certified.
Youth mental health, first aid, and mental health classes being taught to all school children from kindergarten all the way through college.
And annual checkups, including comprehensive mental health screening questions.
Workplaces embracing mental health training for their employees and changing workplace culture to promote positive mental health.
And places of worship partnering with mental health professionals to educate and provide evidence-based therapy for attendees.
And finally, incorporating mental health coverage in all healthcare plans.
Imagine 10 years from now, no one will feel so confused or scared or just alone that they'll try to kill themselves or even contemplate suicide.
As a suicide survivor myself, I know what it's like, and I know that we can all work together to change the conversation around mental illness and mental health, and we can completely eradicate deaths by suicide. So let's all work together to end this once and for all.
Thank you for coming today and enjoy the conference.
Hello, I'm Gerry Blasingame. I am the CEO of Soteria Community Development Corporation. And my big idea is, imagine if every youth, every inner city at-risk youth was required to take financial literacy. And we reward them by giving them free college tuition. Wouldn't that be something? There is a study done saying that youth living in the lowest percentile is an economic development study, economic mobility study, says that youth have a 4.6% chance of ever coming out of poverty. A study done in 2001 states that 1 in 17 white men will go to prison born in 2001, 1 in 6 Hispanic men, and 1 in 3 black males. Now that's criminal. I was sentenced to 20 years in prison for selling drugs because I did not understand economics and money. When I was released from prison, I engulfed myself in financial literacy to retrain myself and to teach myself how to be a better person. What if we did this in America to allow children to gain that financial education that they need? Listen, it costs $87,000 to incarcerate a person in the state of California. It costs $31,000 to send them to UCLA. We can send 2 students to college for what it costs to incarcerate a person. We are paying to criminalize people. People we can pay now or pay later. I would much rather get a return on my investment. We need to do something about low-income people. Thank you.
Hello, my name is Michelle Goodwin, and I'm a Chancellor's Professor at the University of California, Irvine, and I'm so pleased to be here. And of all the things I could talk about, organ transplantation policy, abortion, I want to talk about something old, but that's been moving my soul for quite a bit. And it's about who our real constitutional framers really are. And my big idea is that they're old black women with their opaque stockings and their crooked church hats. And let me explain to you why I believe that that is. Now, my fellow constitutional law scholars would say that it's a heresy, that it's blasphemy. After all, this is not what we were taught in law school. But a constitution that exists only on paper is more illusory than real. Perhaps it's not even worth the paper that it's written on. When I think about the real constitutional framers, I think about people who fought, suffered, and even died for it, not against a foreign power, but right here at home. And here I speak of poor black women in the 1940s, 50s, and 60s who suffered extreme backlash to secure not only a right to vote, but also health care in the United States. After all, it was Dr. King who said, of all of the forms of inequality, it's injustice in healthcare that's the most inhuman, and I would say also inhumane. And these women and men fought for equality in every aspect of their society, experiencing unspeakable violence, including dying on the steps of hospitals that refused their admission, beaten by police batons on their backs and on their necks, dogs, hoses, you know all of this. But what they wanted was a constitution that was promised but never delivered. When the Civil Rights Act was passed in 1964, followed by the Voting Rights Act of 1965, and then Medicare, these were the first manifestations of an American Constitution for all. And it came about because of women like my maternal grandmother, who was born in Mississippi, had a sense that the United States and our Constitution had unfinished business. And I think we feel her right here, right now. And let me conclude by saying this. Today, we all benefit from the Constitution that these women forged. Thank you so much.
Hi, everyone. I'm Raj Toshi from the Stanford School of Medicine, where my focus involves healthcare innovation for India. My big idea is about frugal innovation, healthcare innovation. How can products and services designed in and for emerging markets have a big impact in the developed markets as well? So here's the problem. Healthcare spend in our country continues to skyrocket. The combination of more technology and third-party payment will make healthcare more and more expensive. Now let's consider less resource environments such as India. Patient-centric and cost-effective solutions are being created to serve the needs of its citizens, including those in the lowest socioeconomic strata. Now, there are a few major challenges in the low resource settings. There are not enough doctors. Healthcare providers are really not as well trained as they are here. Patients are less educated. Very few people have health insurance, so people are paying out of pocket. And there's also major challenges with manufacturing capability and supply chain. All these challenges force a very frugal innovation mindset that we see in India and other places. Solutions must be cost-effective and easy to use. And in my mind, the solution is design thinking to really understand local needs and local solutions. However, these markets offer some advantages too. There's an explosion in innovation and entrepreneurship. There's increasing availability of capital to support these innovations. And finally, there's Western educated experts who are returning home and are leading developers of these new products in country. So we're starting to see the first wave of new products designed in these emerging markets, in these low resource settings, achieving significant utilization in the United States and other developed countries. So my question is if this is an idea whose time has come. Thank you.
Hello. Hello. My name is Yochelson. I am an ambient electronic musician, and I will be speaking on Sunday. My idea is about the last sound you will hear. Several years ago, I was sick, and I had to spend time in hospitals. As a musician, I'm sensitive to sound, and I was so disturbed by all the hospital noise, the alarms, beeps, all the chaos. Lying in a hospital bed, I used to wonder, some people say hearing is the last sense to go when we die. So what is the last sound I get to hear at the end of my life? Since then, I have embarked on a mission to transform the sound experience in hospitals, working with patients, clinicians, hospitals, and device companies to redefine the sound environment in hospital as a public good. One of the social experiments that we do is to collect the stories of people sharing the last sound they like to hear at the end of their lives from all around the world. Thinking about end of life is scary, but that fear is one thing that we have in common that seems to unite humanity. And stories about sound seems to reveal that the beauty of our sensory experience is what makes us human, like these.
The last sound I wish to hear in my life would be a gentle breeze through the trees.
Is the voice of my loved ones.
Loved ones having connected human moment.
It's my children. It's just so easy to say that. My mother's voice.
So here's the idea. And not as a heavy, depressing, scary question, but rather a playful, open invitation that if this could be anything that you like, what is the last sound you like to hear at the end of your life? Thank you.
Wow, those are incredible. Can we give a round of applause for all of our 10 big ideas? So I'd like to officially open Aspen Ideas Health 2019 and invite all of you to join us down the path at the Dorhoser Center for Reception, and also to simply say, this happens every year. We get this huge rainstorm that comes in, and we all get to feel the sounds of it on the tent roof, and we have plenty of umbrellas, so don't worry. Have a wonderful time at Aspen Ideas Health. Welcome.